Have you ever thought about your joints as a kind of window into your body's biggest secrets? Well, it turns out your knees can be incredible detectives. They can often reveal some pretty surprising diagnoses that have almost nothing to do with simple wear and tear. And we're about to uncover what they might be saying about you.
So here's the big question. What are your knees trying to tell you? We're going to go through a few simple tests that you can actually do at home to start decoding those messages. Think of this as your first lesson in becoming a health detective for your own body.
And look, this isn't just some wild idea. As one rheumatologist put it, joint pain is literally a window into your overall health. They see cases all the time where just looking at a knee leads to a completely unexpected discovery. So, come on, let's look through that window together.
Okay, so our first clue, it's all about the shape of your legs. You don't need any special equipment for this part, just a mirror. These are simple visual clues that can actually tell us a whole lot about the ligaments and bones that make up your knee joint.
First up is the hyperextension test. So go ahead, stand sideways to a mirror and lock your knees completely straight. Now take a look. Does your knees seem to bend backward more than about 10 degrees? If it does, that's a condition with a fancy name, genius recurvatum. It basically suggests your knee ligaments are extra loose, what a lot of us just call being double jointed.
But, a flexible knee might just be one piece of a much larger puzzle, and that's where something called the Paget score comes in. It helps us see if this flexibility is happening all over your body. So let's check. Can you bend your pinky back to a 90-degree angle? Can you touch your thumb to your forearm? How about hyperextending your elbows or placing your palms flat on the floor without bending your knees? If you're nodding yes to a few of these, you might have what's known as generalized joint hypermobility.
So why does that even matter? Well, for some people, being super flexible all over could point towards a genetic condition, like Ehlers-Danlos syndrome. In those cases, you'd probably see other clues, like skin that's unusually stretchy or bruises really easily. See how a simple knee test can suddenly open up a much bigger investigation.
All right, let's get back to the mirror. This time stand facing it, with your ankles touching and your knees straight. Now, is there a gap between your knees? A tiny one can be normal, but if you can fit more than, say, 3 of your fingers in that space, you might have what doctors call genu varum, or as most of us know it, bow legs.
Now, while bow legs are totally normal for toddlers, developing them as an adult is a really significant clue. It usually points to one of two things. The most common cause is osteoarthritis, where the cartilage on the inside of the knee wears away, and that literally changes the angle of the leg. The less common cause, but really important to know about, is something called Paget's disease. That's where the bone itself is remodeling in this weak, disorganized way, causing it to actually warp under your body's weight.
And this quote just illustrates the problem with Paget's disease perfectly. Your body's bone rebuilding process basically goes haywire. It's breaking down and frantically laying down new bone, but it's just chaotic. The new bone ends up bigger and thicker, sure, but it's also much weaker, just like a wall built by a crew that's just throwing bricks around.
But let's circle back to osteoarthritis for a second, because it is so much more than just wear and tear. Especially if you get diagnosed before you're 50, you need to think of it as a major wake-up call. It's strongly linked to metabolic issues like diabetes and high cholesterol, and even higher rates of heart and kidney disease. So that pain in your knee, it's really signaling you to look at your broader health picture.
Okay, so far we've been laser focused on the legs, but now our investigation is going to zoom out. Because sometimes, believe it or not, the most important clue for a knee problem isn't in the knee at all.
Here's another simple test you can do right now, wherever you are. Press the nails of your index fingers together, back to back. You should see a little diamond-shaped gap of light right between your knuckles. If that gap is gone, that's a sign called finger clubbing, and it can be a major red flag.
And just how serious are we talking? Well, get this. There's a case study of a 44-year-old man who went to a specialist for some mysterious knee pain. The doctor noticed his finger clubbing, ordered more tests, and discovered the patient had undiagnosed lung cancer. His knee pain and his clubbed fingers, those were the very first signs. It's a powerful reminder of why we have to look at the full picture of symptoms.
All right, now let's talk about the timing of your pain. Do you wake up feeling incredibly stiff, almost like your joints have turned to cement overnight? This is called the gelling phenomenon. And honestly, the best way to think about it is like Jell-O. When it's hot, it's liquid and moves easily. When it cools down, it firms up. If your joints are super stiff for more than 30 minutes in the morning, but then get better as you move around, that's a classic sign of autoimmune inflammatory arthritis, where your own immune system is attacking your joints. And that inflammation can be part of a much bigger picture. Just look at how these symptoms tend to cluster together. If you have knee pain, plus bowel issues and mouth ulcers, a doctor might start thinking about Crohn's disease. Knee pain with some scaly skin patches, maybe hidden in your scalp or even your ears, that could point to psoriatic arthritis. The big takeaway here is to keep track of all your symptoms, even the ones that seem totally unrelated. And hey, take pictures of any rashes. They are all potential clues for your doctor.
Okay, for our third and final clue, we're zooming back in. This time we're focusing on things you might actually see or feel right on or around the knee itself. These lumps and bumps can be very specific calling cards for different conditions.
Let's start with a number that's, well, it's pretty staggering. 60%. That's the percentage of people with untreated Lyme disease who will go on to develop arthritis, often months after the first infection.
Now, the classic sign of Lyme disease is that target-shaped rash, but here's the thing, not everyone gets it. The arthritis it causes is really distinctive. It usually affects just one knee and causes this massive, dramatic swelling. It can also cause inflammation of the facial nerves, which leads to something called Bell's palsy. And with warmer temperatures allowing ticks to spread into new areas, this cause of knee pain is definitely on the rise.
Now, what if you notice actual lumps on your knee? The type of lump is a huge clue. Is it a xanthoma? That's a fatty plaque in the skin, and it's a clear signal of underlying metabolic issues like really high cholesterol or diabetes. On the other hand, it could be gouty tophi. These are hard lumps made of uric acid crystals. They're a hallmark of gout, which can be linked to kidney disease, since it's the kidney's job to flush out all that excess uric acid.
And what if your knee suddenly swells up and a doctor finds it's filled with blood? If there was no big injury, no major trauma, this is a very serious sign. It suggests your body is having trouble forming blood clots. Now, this could be from blood thinner medication or a genetic condition like hemophilia, or in some really rare cases, it can be the first sign of something as surprising as scurvy or even a kidney cancer that has spread to the bone.
We have covered a lot of ground, but I need you to listen up because this last section is by far the most important. These are the non-negotiable red flags. If you experience any of these symptoms, the time for sleuthing is over. This is when you need to get immediate medical help. I want you to really let this quote sink in. It's something orthopedic surgeons say, time is cartilage. They say this when they're talking about a septic or an infected joint. A bacterial infection inside your knee isn't just serious, it's a true medical emergency that can literally destroy your cartilage and bone within hours and potentially lead to permanent disability.
So here's the bottom line. You need to go to the emergency room if your knee pain and swelling come on suddenly and severely. Go to the ER if the pain is so bad it wakes you up from a deep sleep. Go if you also have a fever. And absolutely go if you cannot put any weight at all on that leg. Any one of these signs could mean a joint infection, and getting it checked immediately might just save your knee or even your life.
From the shape of your legs all the way to the timing of your stiffness, your body is constantly sending out signals, and your knees, it turns out, are one of its favorite messengers. So the real question is, are you tuning in and actually listening to what they have to say?